Good evening, it's Dr. John Bennett. We have another in a continuing series of Parkinsonism educational hangouts with Dr. Abdul Rana, neurologist from Toronto and world-renowned Parkinsonism educator. Tonight, Dr. Rana is going to be talking about the poor dental hygiene in Parkinsonism. Good evening, Dr. Rana.
Good evening, Dr. Bennett. How are you this evening?
Very good. Is it snowing again up there?
Oh no, snow is melting now.
Oh, okay, it's melting. It's like Miami. Well, actually, we have no snow to melt. We never have. Anyways, okay, let me start off with a question. How does dental hygiene relate to Parkinsonism?
Dental hygiene is a very important issue in patients with Parkinson's. As you can imagine, when Parkinson's disease starts on right side, because initially the onset of Parkinson's disease is usually on one side. So when it starts on right side, the dental hygiene becomes an issue even from the start, because these patients have stiffness, they have trouble with dexterous movements, they have slowness, they may have a very severe tremor. So all these symptoms like slowness, stiffness, tremor, they interfere with patients' activities, and they lead to poor hand-mouth coordination. So these patients have trouble brushing their teeth. So that leads to poor dental hygiene. Another issue is swallowing. As the disease progresses, these patients do develop trouble with swallowing, trouble with chewing, because they can't chew properly. So some of the food remnants may be left over in the food, and also because of difficulty swallowing, they may have food remnants left over in the mouth. So that also causes issues with dental hygiene. And saliva, the normal amount of saliva is good for the health of teeth. And when there is too much saliva or too little saliva, of course, it would affect the teeth as well. So these patients, because they don't swallow, so in the beginning of disease, they have pooling of saliva in their mouth. So a lot of saliva accumulates in their mouth, and sometimes then their mouth stays open as disease progresses, and saliva flows over the lips. It can cause the lip breakdown, the skin breakdown, because it stays wet all the time. And those patients who get treatment for drooling, if they are treated aggressively and there is lack of saliva, so then still it would affect the dental health, such as those patients who have botulinum toxin injections. So their saliva might dry up, so that could lead to difficulty maintaining the normal health of the teeth. Also, some patients who have a jaw tremor, there are certain patients with Parkinson's, they have a jaw tremor, so the upper and the lower jaw, they chatter, and they strike against each other constantly. So that could lead to some problem with the teeth as well. So these difficulties, as disease progresses, get worse, and therefore the dental hygiene becomes an important issue which you need to educate these patients about.
What can the consequences of this be?
The dental hygiene issues can lead to many problems, such as social withdrawal. When these patients have poor teeth, they may have bad breath or a foul smell coming out of their mouth, and they start avoiding other people, or sometimes people may make them realize by saying, so that would hurt their feeling and could lead to social withdrawal. And also dental diseases like dental caries or other dental issues could arise from this. And these patients may have difficulty maintaining their spousal relationships because of this. That could lead to poor self-esteem as well. And also because they have issues with their teeth, so they have to have to see the dentist more often, so it could lead to another cost on top of their other costs for medications and other healthcare supplies. So frequent dental assessments and any procedures if required, they become an additional cost. and also they have to undergo some investigations if they need some procedure to be done. Suppose if they retain food elements that can lead to cavities in the teeth. So when you have a cavity, and so you start getting pain in your teeth, so you have to see dentists, so you have to have more x-rays, more procedures, and the fees associated with these things, and also the inconvenience associated with these investigations you have to be subjected. So these problems do add up to the miseries of patients who are already struggling with this disabling condition.
How can these problems be addressed?
I think from the scratch of the condition, we need to educate patients so that they can be very cautious from the beginning. They are aware of this problem, that this could arise if they don't attend it properly, such as brushing their teeth regularly after every meal. And if patients have difficulty brushing their teeth with their right hand, if they are right-handed and Parkinson's disease starts on the right side from the beginning, they may ask a family member to help, or they could use the electric toothbrush, which is much more faster and much more thorough. And they should at least brush their teeth for several minutes, at least more than 3 minutes or so. And also they should try to keep their head straight so that the saliva does not accumulate in the front part of the mouth and stays with the gum and teeth and the lips. If that is the case, they need to discuss with the physician or their treating neurologist so that the drooling can be addressed, which can lead to this problem. Also, visiting the dentist regularly and avoiding foods that can lead to excessive saliva production, such as sugary foods. They can lead to more saliva, and eventually they can have effect on the teeth. And in addition to saliva producing, the sugary foods themselves are not good for the health of the teeth all the time.
You know, Dr. Ron, I'm just going to make a comment that listening to you speak about the things the patient must do and know about, a Parkinsonism patient has to be very educated in many areas.
Right. I think the education is the first step of treatment, and they have to be educated. They have to be emphasized the need for education, and education should be provided at their level, at a very basic and lower level.
Yeah. I don't know of any other disease that needs so much education.
Yeah, I heard one of the very well-known neurologists and a teacher of many other neurologists like me saying that I think Parkinson's is the most complex neurological condition.
Yes, it certainly does seem. Well, anything else to add about dental hygiene and Parkinsonism?
I think the screening is also important. When these patients see neurologists in follow-up visits, so most of the attention is paid on their eye movements, or they're checking the tone in their limbs, or tremor, or slowness of movements by checking the repetitive movements and gait of these patients, or balance. So I'm not sure how often we pay attention to the teeth of the patient. I think we should look into at least we should do a good oral examination in the follow-up visits, and we can advise patients then, if required, they can see a dentist, and also talking to them about various symptoms like dental pain, or if they have dental caries, or increased sensitivity to the cold foods or to the sweet foods. I think patients, we need to educate these patients about this, because teeth are a very important part of human body, and they play a great role in chewing and eating, and food is an important element of our life, and not only enjoyment but a necessity, the most basic necessity, and teeth have a greater role in the act of eating. So I think because Parkinson's could affect this important component, we have to talk to the patients very openly and warn them about the consequences if the proper attention is not paid to this issue.
Very good. That wraps it up for dental hygiene and Parkinsonism. Thank you, Dr. Rana.
Thank you very much.